Good evening, everybody. Welcome to our TheraPsil webinar, where today we'll be providing an update on some recent news from Health Canada. We'll be talking about the SAP process. We'll give an update on some patient and healthcare practitioner exemptions, and also be talking about some of our strategy moving forward. We're joined today by Natasha, Janis, and Thomas. Thomas and Janis are both patients that we're supporting with Section 56 and possibly SAP access. And Natasha is our patient intake director at TheraPsil. So thank you all very much for joining. Just for some housekeeping, at the bottom of your screen, you'll see there's a Q&A function. So if you have any questions, please feel free to just pop those questions in there. It will ensure that we don't lose them, because if it goes into the chat, then sometimes it gets washed away with comments. But if you do want to make comments, please use that chat function. Feel free maybe to start just sending us where you're calling in from today. It's always pretty interesting to see where people are calling from, often international and always from across Canada. So thank you all for joining. Without further ado, it looks like it's 4:02 here, so we'll get started. So first, to start off here, I want to make a quick land acknowledgement and acknowledge that I'm currently conducting this Zoom on the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations, and also want to acknowledge too that the psilocybin mushrooms that we're working with are here and have been here for thousands of years because of the amazing ability of Indigenous communities around the world to be able to pass on that knowledge. So I want to be grateful for that. So I'm just going to allow each of the speakers here to introduce themselves. I'll start off. My name is Spencer Hawkswell. I am a patient rights advocate and the CEO at TheraPsil. And I'll pass it over to you, Natasha.
Thanks, Spencer. Hello, everyone. My name is Natasha Fearnley. I am TheraPsil's clinical intake director. Have been working with TheraPsil for a couple years, helping to support patients and build out our processes for access to psilocybin in Canada. I'm also a registered nurse with some background in palliative care and facility management, and just feeling really blessed to get to work with individuals like Janis and Thomas. I'll pass it over to Janis to provide us an introduction to herself.
Hi, I'm a stage 4 breast cancer patient. I received my diagnosis getting on to be a year ago. And I learned about psilocybin-assisted therapy maybe at the end of last summer, and was thrilled to find TheraPsil. And yeah, I've been on a voyage of discovery, just reading everything I can lay my hands on and working my way through this process, which is an adventure in itself. Is that good?
And I guess that leaves me. My name is Thomas Hartle. I am a stage 4 colon cancer patient here in Saskatchewan. I have had stage 4 cancer since 2016. And in 2020, I was fortunate enough to become the first person in Canada to have access to psilocybin-assisted psychotherapy. So I have already experienced the benefits of this medicine and this therapy on a few occasions now. I am currently waiting for renewal on my new Section 56, which has been in process for quite some time now. In most of my my time while I'm waiting for that, I am doing patient advocacy for things like this, and trying to help inform people about the benefits of this type of treatment and what its potential is.
Thank you very much, Thomas and Janis, for joining us. Yeah, we really appreciate it. And I want to just acknowledge and appreciate that when you're speaking here, you're not only speaking and advocating for yourselves, but many other people who can't make it to this call. So thank you very much. So I want to first provide just a quick update on some of the things that have progressed since our last call that we would have had regarding exemptions. The first and foremost are SAP changes have been made from Health Canada. SAP stands for the Special Access Program. And for the last 2 years, TheraPsil has been communicating that the SAP Special Access Program would be insufficient to supply the number of patients access to psilocybin for a number of reasons. Since the SAP was opened up in January of this year to allow patients to get access to psilocybin, we're not yet aware of any patients that have gotten access. We've now been working for about 2 months with doctors and patients to get access. And while we're hopeful that the first batch of patients will get access through SAP, we are finding that there are significant challenges to that process, least of which being the need for a trained doctor to be able to prescribe psilocybin, the drug. What we're finding is that that is quite difficult, and that some doctors do not feel that they have the correct ability or skills, and sometimes even the licensing to be able to prescribe controlled substances. So part of that issue too is in the fact that we've also received about 92 intent to deny letters from Health Canada for healthcare practitioners who are seeking to use psilocybin in their training program. And so again, this is a bit of a cart before the horse issue where if healthcare practitioners are denied access to psilocybin for training, who is going to be able to help patients either through SAP or Section 56, or quite frankly, even through clinical trials as they seek access to psilocybin. So those are two of the biggest issues. And on both of those sides, we have connected with legal teams and with a number of members of Parliament to try and get an immediate response from the Honourable Minister of Health, Jean-Yves Duclos, so that we can see immediate responses to those denials for healthcare practitioners and to see if we can get a speed up on the Section 56 exemptions. And that finally kind of leads us into, I think, where I'd like Janis to be able to speak, as a number of patients have been told by Health Canada that, or have been denied Section 56 access by Health Canada when they were given a letter a number of months ago indicating that Health Canada would not be processing their Section 56 exemptions. So Janis, I would love to be able to put it over to you here to maybe share a bit about your story, how you got to know about psilocybin, how we got your exemption together, and some of the challenges you've been having in seeking an exemption from the Minister of Health.
Sure.
So I'll put it over to you.
Good. Well, I learned about the work being done at Johns Hopkins from watching the Fantastic Fungi documentary. It was quite a surprise, and it was also a surprise to learn about the medicinal effects of mushrooms for treating cancer as well. So I was quite thrilled to stumble upon that information, which I wasn't expecting at all. And so I just started researching on the internet and found Tim Ferriss's blog. He's got hours and hours of podcasts on the subject of psychedelics. Did a lot of reading. And well, I only just reading Michael Pollan's book lately. I'd heard enough interviews with him that I kind of had the gist of the book. But it was just really fun. I just read about his psilocybin experience the other day, actually, and it was, again, very encouraging. Everything that I read about this experience speaks to me. Before I came upon, stop me if I'm going on too long here, but before I fell upon the Fantastic Fungi documentary, I had read the book Radical Remission, and was looking at the 9 factors that are common to all cases of remission of cancer. And most of them, only 2 of them relate to physical stuff, the diet and herbal supplements, and everything else relates to emotional and spiritual stuff. And, having a reason to live, thinking positive, dealing with repressed emotion. And it seemed to me that what I read about the psilocybin-assisted psychotherapy would not only relieve my anxiety about dying, but also help me get at the repressed emotion bits and help me deal with some of the emotional problems that I've been living with, and all of which could aid in not only in extending my life, but possibly promoting remission. So I had very strong reasons for pursuing this. It's part of a larger strategy. I'm doing everything I can to implement those 9 factors. So in the course of my research, I found out about psilocybin. Part of my problem was that I live in Manitoba. There are no therapists here advertising their services. The therapists that are here are underground. They've slowly started revealing themselves to me since I went on national CBC. But part of pursuing this pathway was to get access to the therapy bit. Obviously, it's not really a problem to access the mushrooms themselves, but I very much wanted to take it in a structured environment that was going to be safe. We're proper set and setting, we're going to be assured, and that we would maximize the potential for a good experience and a beneficial one. So it's my quest for getting access to a trained therapist that launched me on this process with TheraPsil. So my application didn't get in until after the SAP thing came through. So my rejection letter, it wasn't an outright rejection, but it stated that I had not satisfied them, that I had exhausted these 2 other legal pathways, which were a clinical trial and the SAP process. Well, I have 3 cancer care providers. One of them, when I first spoke to him about psilocybin, he never heard of it for this use, this purpose. I had asked him if he would fill out the physician part of the application form for Health Canada. And he said that that was for my GP. So not a lot of cooperation there. Then when I read about the SAP coming in, so before I got my rejection letter, I actually had an appointment with my oncologist, and I was telling her what I was doing because I'd been told that Health Canada might be wanting to contact her about my prognosis. So I said to her, I told her what I was doing. She had heard of psilocybin being used for this purpose and was rather intrigued and favorably disposed, but really didn't know much about it. And so I said, well, this new mechanism gives you the right to apply on my behalf, apply to prescribe this to me. And she seemed to be aware of the SAP process, but didn't want to go there. And she was kind of referring me to doctors that she thought, she didn't make an actual referral, but she was just saying there are doctors in a program that are familiar with that process, and that would maybe be something for them to do. But that wasn't really helpful to me because I don't know those doctors, they don't know me. And and what do they know about psilocybin? They're prescribing other things. So that I didn't find helpful at all. So I'm thinking no cooperation there. And so then I got my rejection letter. So I thought I'd make one last try. It was my GP who had filled out the physician part of the original application to Health Canada. So Natasha and I agreed that we would go back to her. And she had actually said that filling out the application was kind of the limit of her involvement. She wasn't really willing to be a supporting physician. But we tried her anyway, and I spoke to her Wednesday, the day after my infamous meeting with the medical health advisor, the chief medical advisor for Health Canada. And she said no. So I'm back to wanting to pursue the Section 56 exemption. On the day before I had my meeting with my GP, Spencer and Natasha and I had a meeting with the chief medical advisor for Health Canada, who reached out to me because of the CBC story that was on the national news. And she was wanting to help me negotiate or navigate the system. So that meeting was very, very disappointing. They were insisting that the SAP process was easy, whereas everything we've heard from regular physicians is that it's hard and time consuming. And because they're engaging their professional liability, they want to know what they would be prescribing. So they'd have to do all of the, reading of the research studies and so on, big time investment. And in Manitoba, our system is really stressed and people just don't have the time. So, but they seem to be insisting on the SAP process and telling me it was for my safety. And my response was that I'm dying. It's rather paternalistic and absurd that you're concerned about my safety. And I had a conversation with a cousin who's a nurse afterwards. I was relating this story to her, and she said it reminded her absolutely of when they were fighting to use drugs like morphine with patients. I assume, I don't remember this fight, I guess because it didn't really affect me. But it was the same kind of argument being put out. Here you had patients at the end of life, the government was saying, but we can't be giving these patients addictive drugs. And the patients are going, what do I care if I get addicted? I'm dying. So it's the same absurdity that we're facing today. And I find it quite ridiculous. But anyhow, where I'm at today is that I am still waiting for my GP to give me the letter stating that she is not inclined to pursue an SAR for me. And the chief medical advisor told us that that would be sufficient proof for them that I had exhausted that process.
Thank you so much, Janis. And I just want to repeat, because it was something I wrote down right when you said it, to Health Canada. And I think we make it clear here that part of what they were asking is that we exhaust SAP in Section 50 and clinical trials. And it was in our original application and communications to the government that we told them that those would not work, both because of time, resources, and constraints, geographical constraints. So, it was interesting for us to say that those weren't options, for them to come back and say, no, they are, and argue. And I just remember you saying something. It said it feels very patronizing to hear Health Canada say they're worried about me and my safety. When I'm suffering and I've done my homework and I have a doctor's support, I can access MAID in as little as 10 days. And they're blocking me from accessing a mushroom because they're worried about my safety. Mm-hmm. So powerful, and you spoke very well then. And I'm hoping that, from that conversation and from future conversations, we're able to see that it shouldn't be one or the other. It should be both, either Section 56 or SAP, whatever gets patients access to the substance. And there's no reason that we can't work on Section 56, get an exemption, and then in the future find ways to get an actual drug to that patient. So thank you for joining that call and for reiterating what happened to the people on this web call.
Well, yes, and well, just it maybe isn't all that important in the long run, but I was really taken aback. There are no clinical trials here in Manitoba. There's none across the country that I could find that were recruiting. And I don't know, they kept talking about clinical trials, and how you can do a clinical trial with as little as one person. And I'm going, what are you saying to me, that I should go and try to convince a researcher to mount a trial around me? Are you putting the onus on me to mount a clinical trial? Like, it just was so unhelpful.
Well, and in those instances, it really can be policy for the sake of policy instead of policy for the sake of the people that policy tries to help. And when we realize that it's not working, I think that was part of the awkwardness of that call was, I remember us kind of standing there saying, hello, you're speaking to a human being here who's looking to access a mushroom. Can we speak to a human being? Not to a bureaucrat. And unfortunately, it's kind of what it was left. So thank you, Janis. And we'll come back and talk to a bit about the possible solutions around SAP or reasons why Section 56 must continue. And to do that, I feel like, Thomas, we should introduce a bit about your successes with Section 56 access and accessing psilocybin, and then a year later your challenges with getting that same access. So I'd love it if you could tell us a bit about what happened in 2020, 2021, and now what you're fighting for in 2022.
Absolutely. So I was originally approved for my Section 56 in August of 2020. And that was the culmination of, for me, roughly 100 and some days of waiting to get the application approved. Now, that application approval process has been completely different from what happens with my current renewal request. My interaction with Health Canada and the minister was actually fairly active. The application went into Health Canada. They had a few questions for me to clarify things, provided information on that, information from my supporting doctors, and ultimately the request was approved in ignoring the time frame involved, a relatively painless process. As a result of having that Section 56, I did manage to get 3 different psilocybin-assisted therapy sessions. And for me, the results of those sessions were really, the only way you can describe it is life-changing. I went from a state where it was almost impossible for me to be able to just deal with regular day-to-day life things, being able to concentrate on spending time with my family, enjoying quality of life, being able to function on just a normal basis, and to a state where really I feel almost normal again. So you go from a state where you're wondering if every single day is going to be your last day, to being able to realize that if I pay attention to that, I'm not enjoying the things that we're here to enjoy. What's the point in living if you're not actually enjoying any of it? And so for me, it was really getting my life back. And so I can tell you with certainty that having the psilocybin-assisted therapy is a treatment that I absolutely know 100% is completely effective in my case. Of course, I can't speak for everybody who has had the treatment, but I can tell you that everyone that I have talked to who has had the treatment, and all of the other patients that have gotten approval and have gotten access to the therapy, I have heard nothing but a stream of people who have been very happy and have had similar life restoring responses to the treatment. So when my Section 56 expired at the end of, I guess, in August of 21, so they're only valid for 1 year, which is, again, in my opinion, a little unusual. It's not like the rest of my life is going to be such an extended period that I think I should have to renew this every year just to prove I'm still alive. But I had assumed in 21 that the renewal process for me would probably be the equivalent of a rubber stamp, because I have already jumped through all of the hoops. I've answered the questions. I've done all of the research, I have taken the treatment, and I have proven that it's effective. So all of the elements in my belief is covered. What else is there? And instead of getting the immediate renewal on my Section 56 to continue the treatment, which is effective, I have received literally nothing but the automated responses from Health Canada. So complete silence on the issue. I haven't even so much as received one of the denial letters, which have gone out to so many others. I have literally received no response but the automated reply back that they have received the emails that I have sent. So for myself, because I've already done the treatment, I don't really qualify for clinical trials because I know what the therapy is like, and I've already used psilocybin. So that would, of course, completely exclude me from any placebo possibility. And of course, I'm not looking for to see if I respond to a placebo effect. I am looking for the therapy, which I know already works.
Thank you very much for that, Thomas. And you're right about the clinical trials. I mean, I don't think it's very fair to be subjugating people towards a clinical trial where they may or may not get access. And even in the case of a clinical trial of one, where you are getting access, I know that in the US, they actually have an ethics code that says it's unethical to push someone towards clinical trials when you don't have a question. And in your case, what would the question be? Is psilocybin effective for Thomas? I mean, it's not very frequent in our life that we get to be 100% certain about something. But in your case, I think it's fair to say that you are certain about that.
Very much, yes.
Yeah. And I think that, in that same era, there's, just on the basis of of equality in this country, I don't see a reason why Janis shouldn't have the same rights that you did back in 2021. What applied and was granted to you under pressure from our legal team and under pressure from the law, and what was granted to other patients like Nathan Kurzak because of a legal push, I don't see why that law wouldn't also apply to the two of you. So, there are logical inconsistencies in what the processes have been in the past, and there are logical inconsistencies in our access to things like medical assistance in dying, right? A drug that its side effect is cardiac arrest and medical death. Why would it be inappropriate to prescribe a patient something like a mushroom that may or may not hurt someone, and for which we actually have quite a bit of clinical data on its safety? So, thank you both for sharing these very frustrating, very frustrating things that you've had to go through. And I now want to turn it over to Natasha, as Natasha is our clinical intake director at TheraPsil. And her role for the last 2 years now has been helping patients such as Janis and Thomas through both Section 56, finding clinical trials when they're available, and SAP. And it is Natasha's role and responsibility to find out when it's acceptable to send someone to a clinical trial, when it's acceptable and possible to support a patient through SAP, and when Section 56 is the only and last resort. So, Natasha, I'd love to put it over to you as the person with perhaps the most experience in the world, quite frankly, in helping patients access psilocybin and going through medical screening. I'd love to hear a bit about what you're seeing on the ground.
Yeah, I think I'll start by just something that's coming up for me as I'm hearing Thomas and Janis both speak is the inconsistency in what is happening here based on what we've seen previously. And so previously, as we've helped individuals to navigate the Section 56 process, in the midst of that, when the precedent was set that we communicated to Health Canada the need for this psilocybin, and our Minister of Health addressed that understanding and knew that this was a need, that these people needed compassionate access. we were seeing these exemptions being granted, and many of them were being granted in a very short time frame. There was a moment where if we were to communicate to Health Canada through our clinical process that proves that they have support of a physician, proves that assessments have been done to ensure that it's the best option for them, proves that they've tried other treatments and those treatments haven't been effective, and that they're going to be supported to get treatment through people who are trained to provide this. When we provided all that information, we were then also communicating to Health Canada if this individual was facing at end of life and if the need for the exemption to be granted was urgent. And at times we were seeing Section 56 exemptions being granted in less than a 24-hour turnaround, because they in the office understood, or it appeared so, that they understood the need for this in a short time frame, that it was urgent, that people could not wait to gain access. And we were like, oh, they're understanding that this is important and that it can't wait. Hallelujah. And then what happened is on January 5th, when the SAP amendments were enacted, our patient wait list just started to grow, and we didn't know why. We're like, okay, we're going to learn how to navigate SAP, but why are Section 56s not being responded to? And it wasn't until 20 days later that this group of individuals who had submitted after the SAP amendments were then communicated that they had to go other routes. So they already waited 20 days without any information as to why they weren't gaining access. But then something that we're noticing now in March is that the SAP process doesn't have, or they may just now have producers who can provide the psilocybin. Maybe at the beginning of March, in the last couple of days, that's been somewhat confirmed. So that means for the last 2 months, there wasn't any way to even access a psilocybin product through the SAP process. So Health Canada has been communicating to these patients who previously they recognized as needing urgent access to psilocybin. They're having these patients have no way to access psilocybin for months at a time. It literally was impossible because they weren't allowing access through Section 56, and they were communicating that there's this other way. Of course, there's clinical trials, but these individuals who were reaching out for Section 56 have already communicated to Health Canada that clinical trials aren't accessible to them, and they've already communicated that Section 56 is the best option. Because we were communicated from Health Canada that they needed to go clinical trials or SAP route, we then communicated back that SAP is no longer an option, like Janis did. Isn't an option, a viable solution, and they still got the same communications that Section 56 isn't a viable solution. And so when it comes to our values at TheraPsil, as well as what was displayed previously from the communications at Health Canada, it doesn't align with compassionate access. Like, what's happening isn't compassionate, and it isn't providing people access in the ways that they need. And I'm sure that Janis and Thomas and other individuals who have gone through this process can speak to actually the negative implications of the waiting period and the unknowns and the energy that they're putting into being on this webinar and sharing their truth and advocating through media. And there's a lot of patients who we've supported that I've connected with individually who don't feel as though they have the capacity or feel safe or can speak up for themselves. And Janis is the only one who received communication from the medical health advisor from Health Canada, the physician who advises Health Canada. And the other patients who didn't speak out for themselves, they did not receive an offer to communicate with Health Canada. So those people are being ignored. And it's because of people like Janis who are putting in this energy and advocating that we are learning what's going on with this process that's not the way it should be. And thank you, Janis, and thank you, Thomas, and thank you to anyone who advocates. But I just want to kind of circle back to the distress that I see it causes people versus the healing I see that psilocybin therapy provides people. It is like two extremes on a continuum, right? You're in this situation where I'm seeing people are really vulnerable and they're not okay and they're sick and they're experiencing this end of life distress. And if they get access to psilocybin therapy, they're expressing this increase in their well-being, this groundedness in their present moment, versus if they're fighting the government for access to psilocybin, they're feeling like it's, and I'm sure it could be empowering as well in a lot of other ways, right? Speaking up for people, but you shouldn't have to, right? They shouldn't have to be speaking up. I kind of went on a rant there, but I feel like I'm feeling very passionate about patient access because I'm feeling frustrated with the shift, although I'm hopeful that this is just going to pave the way for regulations, because we're going to prove that SAP isn't a viable solution as we navigate it and as we support practitioners to support patients to do it. It's only going to give a small number of people access through the SAP, only a small number of patients who meet the specific criteria Health Canada wants, the specific criteria the producers want, who has a physician who can support, which is very limited because not a lot of physicians in Canada have experienced psilocybin because they don't have access to experiential training. So SAP isn't a viable solution, even though it feels somewhat like a step forward. We need regulations so that Janis can go to her doctor and Thomas can go to his doctor and get a prescription and come and be supported by their physician and their treatment team to get psilocybin when they need it without this fight.
Thank you, Natasha. Very, very well spoken. Janis, sorry to interrupt you there.
Yeah, no, well, I think what's the picture that's emerging for me is that the SAP process was lobbied for by Numinous and possibly other companies that have all three aspects of this business covered. They process natural mushrooms and produce synthetics. They do research, they do clinical trials, and they also have a therapy wing. So it seems to me these Numinous is set up for, they're going to have a psychiatrist on staff, I'm sure, who can apply for the SAP for the patients that are going through their therapy. And I see it as a narrowing, a sort of funneling of patients to companies like Numinous, where they have a prescriber on staff who knows the system and for whom it's nothing to file an SAP, an SAR. So I feel it's like narrowing choice. We don't have a company in Manitoba like Numinous. And I'm learning there may be physicians out there who might be open to filling this role of completing SARs for patients, but it's going to take time to identify them and bring them up to speed. And then how do they communicate with patients? How do patients know they're available? I think that even if there was a company like Numinous, maybe I wouldn't like their style of therapy. Maybe I wouldn't like what they're offering, and I would really rather go to another therapist. Well, I don't think a company like Numinous is going to do an SAR for me and then let me go to a therapist of my choosing. So this is how I think that the SAP may be good for assuring the safety of supply, but I do think it really narrows choices for patients. Does that make sense?
It really does. And I know something that we continue to tell the regulator and that we speak to with patients and doctors is it should always be both, right? Why not have the SAP and have these clinics that are able to support patients who are able to access through them? It's a great thing. It's wonderful. But if we leave out, the large majority, in my opinion, of patients who will not be able to access psilocybin through a clinical model, through a clinic, and who want to do it at home. And I think it's interesting at looking again at what some of the expectations are of psilocybin use versus what the realities are is, out of the 65 patients that have exemptions right now and are getting treated, maybe only a few of them have done that in an actual clinic. Everyone else has done them at home, and it's been very comfortable for them to do them at home. So it's again this idea of writing policy for the sake of policy instead of speaking to and communicating and working with the patients and healthcare practitioners on the ground. And it was a huge wake-up call for us with COVID, right? To learn that that's the way that healthcare has to be sometimes, is not top down, but bottom up. And that same issue is presenting itself here, where, you know, our communications to Health Canada for the last 2 years has been that the SAP will be insufficient for these reasons. And yet here we are 2 years later now running into those issues. So it should always be both. It should be SAP, and that should be an avenue. And when it's easier, that should be the approach. And when it's not easier, and when it's not better for the patients, and when the doctors and patient don't believe that that's the best avenue, you know, we should be opening up Section 56 and allowing patients like, you know, yourself and Thomas access to, you know, the mushrooms that you're able to find. And I mean, Lord knows they're pretty easy to find in Canada these days. So even then, you know, a step beyond that might be looking past Section 56 and SAP and finding a way to put together medical regulations that allow for this to be done the same way that cannabis was dealt with. Because Thomas, I know that you've spoken about your cannabis use in prior webinars. I mean, do you see it as hugely different, or do you believe that the same, you know, some of the same principles about either growing and how you access to cannabis should be applied to your new medicine, psilocybin?
Yeah, honestly, very similar. So we're looking at you know, a natural product that has a long history of use and a good evidence base, very, very low harm profile. So for me in this case, I do find very much similarities between what I think could happen with the approval process or the prescribing process for psilocybin therapy as the cannabis model that was previously used. I would like to step in a little bit on Natasha's rant, because you know, from my perspective, the foundation of that Section 56 process is compassionate access. And you know, beyond looking at the safety and you know, prescribability of a product, which I will not deny are very important elements, the fact of the matter is, at the end of the day, we're dying. We are on a daily basis have limited amounts of energy available. We are struggling to live. We're struggling to function. And to then also have to struggle against the government preventing us from having access to the very thing that can allow us to fight a little harder. If, as Janis had mentioned earlier, we are not so occupied with the thoughts of our impending death and the amount of suffering that we just have on a daily basis. I realize most of the time when I'm on webinars and things, I've got a smile on my face and I'm very positive. But the fact of the matter is, having stage 4 cancer is a lot of discomfort. It's very draining emotionally. It's a lot of pain. It's a lot of anxiety about what's going to be happening in the future. And to have Mr. Duclos contribute to this, and make no doubt about it, the denials, the amount of difficulty they're adding to the process, just being ignored completely in my particular instance, is directly contributing to the amount of misery and suffering that I in particular have, and everybody else who is also in the same position as I am. So it seems to me that we have taken a very large step backwards in this idea of compassionate access. The government, in my opinion, with their current approach, has really kind of thrown compassion out the window for something that is really not fitting to this kind of a situation. That's my rant on the matter.
Is it possible, Thomas, that they know who you are and that you've already been granted once and they really don't know how to respond to you other than by an automated letter?
Boy, it would be nice if they would even say that much, because if that were the case, then I would have something to say on the matter. But complete silence on the issue really doesn't allow me much of a recourse to respond.
They
Yeah,
know who Thomas, if they knew who Thomas was, they'd know not to fuck with them.
I was just looking at my spreadsheet, Thomas, and it's been over 160 days since you've resubmitted your request for a renewal. So it's been a long time, and exemptions were being granted at that point in the dozens since. So I don't understand. I don't really have a logical explanation for you or a rational reason as to why you haven't received a renewal or why you did not yet.
Apparently going onto media like I have and telling Canadians that the system is working and you should try to proceed in a legal and safe fashion is not what Health Canada was wanting me to do. I'm not sure what they want, but telling people that the government is cooperative and they want to help you is apparently the wrong thing to say.
Exactly. And, I just do want to comment on someone's comment in here. It's as if it's a business decision to stall, right? And that stalling, I mean, something we've commented on the past is, access delayed is access denied, right? What's the difference? And, I've seen a lot of different government policies and seen the way that bureaucrats and bureaucracies work. And sometimes the best thing to do is just stall. It's just delay. Don't make a decision. And at some point, you're right. You have to be able to step up and say, no, that's unacceptable, right? Tell us yes or tell us no. And I will bring that up as an important piece as to why yes and no is important. And that will bring us into one of the questions in the Q&A is, are you preparing to sue the government over access? And one of the challenges in suing a government who is stalling is they haven't said yes or no yet. And so if they don't say no, well, then whose rights are being violated, who's waiting? And it means that it's much more difficult to bring an action, because the traditional action to a no by the government, which we have never gotten, is a judicial review, to have a judge review it and say, is this in line with Canadians' constitutional rights to life, liberty, and security of person? And for those of you who are wondering what sort of things would constitute, in line with health, with our life, liberty, and security of persons, it was deemed constitutionally sound that patients should be able to grow their cannabis. So what do you think the answer is going to be for someone like Thomas who knows what his medicine is? It's going to be obvious, and it's a painfully obvious legal challenge that we need to bring forward, but nonetheless, it's difficult when the government stalls and doesn't even say no. So to answer that question on, are we preparing to go to court? I think it's a possibility, and Thomas, I'll let you comment on that too, and Janis.
Well, from my perspective, I see the benefit that the government may be looking for is in our particular case, because we are terminal people. The delaying tactics technically means that some of us are just going to die and we will no longer be their problem. And, to me, that is so very, very wrong. I am absolutely not going to be giving up so easily. And I will be 100% behind a legal challenge to try to get this changed and made better for people.
Thank you, Thomas. So I realize we've only got 10 minutes left here, and I want to allow time for questions and answers. So if anyone has any questions for Thomas, Janis, Natasha, or myself, please feel free to put them in the Q&A. I'm going to try and get through as many of these as possible. So we might not spend as much time on them, but I feel like they're really important to get to. So I'll just try and zip through some of these. So the first is, even if there were requests were accepted Are there enough therapists able to actually process these applications? So I'll comment that in addition to the denials that or intent to deny or delay that we've gotten for patients, we've received 96 intent to deny letters from Health Canada for healthcare practitioners. Again, not a formal denial yet. At this point, we would almost welcome that so that we could bring it to the courts. Yet they've even now delayed the timeline on which they were going to deny in their intent to deny letters. So we've got a legal team ready to support those healthcare practitioners, because at this point in time, we have a wait list of 1,000 healthcare practitioners trying to get into our training program. We've got about 200 healthcare practitioners actively engaged in that training program, trying to get access to psilocybin so that they can train and treat patients. So to answer that question, are there enough therapists? The answer is no. But there is a solution to that, and we're working as hard as we can to fix that, along with many other organizations and training organizations like MAPS and ATMA and the CPA and many others who are trying to train healthcare practitioners. So there is a solution, but again, it's going to take participation from the government, not fighting. So another one here is how many clinical trials are approved. They said they're only aware of ATMA clinical trial, very small, for therapists who want to work in the area. In other words, is it safe for healthy normals who want to support patients in psychedelic psychotherapy? And again, to answer that, there are very few clinical trials, both for patients and healthcare practitioners. And unfortunately—
I heard five in Canada approved in 2022 across Canada. So that's not very many.
It's not enough. And for many of them, the end size is small, so maybe 20 in each. A lot of them, it's also geographically challenging. As Janis was saying, it's not always easy when you live in Manitoba to, head to Vancouver Island to seek treatment. And again, you shouldn't be forced to enter a clinical trial if you don't want to. This is a human right. This is a Canadian charter right. It's not a game of where can we push people. Answer that one. Have you considered any investigator-initiated policy and market access SAP supply? Investigator-initiated policy and market access SAP supply. So Natasha, do you want to maybe comment on how we've been trying to access SAP? And then maybe I can comment on maybe even just why we haven't done clinical trials yet.
Yeah, so when it comes to assessing access through SAP, I don't know if they're talking about product, but I'll speak to that. So my information so far that I've gained is that physicians are responsible for pursuing communications with the producers, and a physician who is navigating the SAP process and submitting a request on behalf of any patient, they're having to reach out to these producers, build a relationship with them, communicate to these producers how they plan on using the substance, and then that producer has to be then approved by, if they weren't already, by this special access program department. So there's a lengthy steps involved for the prescriber who's supporting patients just to get access to a product. There's very few producers, currently 2 right now, that may be going through the process to be about to be approved by Health Canada. And some of these producers have a limited amount of products and will only provide limited physicians who are doing specific types of treatment modules or models. So it's, I don't know if we've considered a specific investigation, but I think ongoing as we're navigating this process, we are, as a community of practitioners navigating SAP, investigating together and bringing our information together into our community of practice collaboration about what's going on with access through SAP and what's going on with producers.
Thank you, Natasha. And just in case in part of this question you're asking why we haven't ourselves put together, clinical trials. Part of the answer of that is TheraPsil is committed to supporting patients who do not qualify for clinical trials. So that's who we're helping, is the people who cannot access clinical trials. And if we wanted to be an organization to conduct clinical trials, we would, but we're intentionally not, because we realize that there are people who would otherwise be left behind. So we've considered it many times. We may consider it in the future for training, but as for patients for whom it's not an option, don't have time and resources, we're dedicated to supporting them. So I'll try and quickly answer just one of the questions here from Cynthia. There, it looks like there's a lot of questions in there, but I feel like upon reading it, I was able to get it. So the question was very simple. Are psilocybin mushrooms decriminalized in Canada? Do patients have the ability to access them without breaking the law? Could they just find a therapist and get treatment? And I'll say that, I see Thomas shaking his head, technically no is the answer to all of that. But what we see is in reality, again, technically it's illegal and it doesn't happen. In real life, it does happen. And many people are forced underground. And that is what's happening right now, is people are forced underground. They're forced to use psilocybin that they've either grown, picked, or bought online with therapists who may or may not be qualified to support them. So, you know, this action of supporting Janis and Thomas and other patients is to ensure that that's not the only option, and to ensure that they're able to get it, as Janis is saying, safely instead of unsafely, by doing it with a therapist who's been trained and qualified. Okay, another question here, and I think this might be for one of the participants. So have you thought about working with Death or Dying with Dignity and other MAID groups who might be able to petition the government? Thomas, I think you've spoken quite a bit with some of the MAID committees. Do you want to comment on some of what you've shared with them?
I have. And actually, most of those discussions occurred just prior to our last election. So there was actually some really good momentum at that time for trying to wrap up some of the psilocybin-assisted therapy into some of, as an option to the MAID system. So the idea, and this has been kind of a battle cry of Bruce Tobin, is that if you have the right to die, you should have the right to try this therapy. Right now, the MAID system is an option to relieve your suffering by ending your life. Why wouldn't you also have an option to relieve your suffering through a therapy that can improve your quality of life? And that is the message that I was taking forward to the different members of the MAID committee. And the response that I got at that time was fairly good and positive from them, a good, compassionate response that you would expect from interacting people to people. But since the election, that is another one of those avenues that has been really nothing but radio silence.
Thank you, Thomas. And I know that it's something that we will continue to advocate for in the future, because as I understand, medical assistance in dying is being expanded for people whom death is not imminent, and may also expand to people with treatment-resistant mental health conditions. For me, this would be a great injustice if in Canada that was, that it might be easier for you to get medical assisted death than it is to access a mushroom that might heal you. So I want to also be cognizant of time here, and just quickly, something very inspiring that Jane Olson posted here from Margaret Mead, a quote: "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." So with that, I just want to say to Janis and Thomas, thank you so much for your time here. Natasha, thank you. And I want to give you all just quick an opportunity to say any closing remarks here, as we're out of time.
Well, I am sorry Mandy couldn't join us. My heart is with her and Bruce. Yeah, Bruce's situation is just so moving and heartbreaking, really. And he's where I'm gonna be where Bruce is someday. And I only hope that I will have had the opportunity to have that solace of having had the psilocybin experience and the peace that I think it's going to bring me. And I also just want to quickly mention that a lawyer friend of mine suggested that there should be a charter challenge called Medical Assistance in Living.
love that.
I like the sound of that, Janis.
Oh, I love that, Janis. That's great.
Okay. Well,
For my final word on that, I'd like to thank everybody who is helping the cause by writing to their MPs. It's really important. If nobody is making noise, then there's no compelling reason for change. And in being able to share these messages from Canadians and sharing these videos, if you put it on your social media and things like that, it gets the awareness out there. And that's what we have to do if we want change to happen.
great.
I'll just chime in at the end and just say, there was a lot of frustration voiced that's reasonable, but I also am optimistic because I think that in the long run, like we've started this movement and I think it's so strong now it can't be stopped. And so this shift is inevitable. We're just impatient because we know that people need access now, but it's happening. So I'm looking forward to that and I want to just speed it up.
Thank you all three of you so much. I look forward to getting this out on social and maybe grabbing some clips of this and making sure that Minister Duclos sees this, because I think really as much as I want to thank the audience and everyone who's been sharing this with their MPs, it is the Minister of Health who has the power to fix everything that we've discussed here. And to take it a step further, not only the power, but the responsibility to act immediately. So thank you all very much. Thank you everyone for attending, and stay tuned. We should have another webinar in a month. My hope is that we have some good news then, because we'll be continuing this fight, however long it takes. So thank you all. Thank you, Janis. Thank you, Thomas. Thank you, Natasha. Have a wonderful evening.
Thanks for the opportunity.
Thank you.